Hi, this is Dr. Andrew Campbell. Welcome, everyone. I'm going to discuss a conundrum in medicine, Lyme or mycotoxins. Which is it? How do you tell? Because a lot of people are confused about this. So let me start by giving you a medical disclaimer. It's just the typical thing that we have to do. I'm the editor-in-chief for 5 medical journals. I've published over 100 studies. I've taught at medical schools. I've lectured at Harvard Medical School, Oxford University in England as well. And I'm a fellow of the Royal Society of Medicine in London. So let's go and divide this up into 3 parts. One is symptoms and signs. What to look for? What are the symptoms? And when you have the disease, how does it manifest itself in a human being? The second will be accurate testing makes a big difference. The third, treatment. What is the most effective treatment to heal, not to treat for years and months, etc. No, to heal. Very simply put, in chronic Lyme disease, the right diagnosis and the right treatment means the patient is well. The wrong diagnosis and/or the wrong treatment, the patient gets years of treatment and it does not help. It marginally helps. Okay, so we start with symptoms and signs. Well, as you can see on the screen, is it mycotoxins, Lyme's, Bartonella, Babesia? What is it? They all have these same common symptoms. And don't forget, ladies and gentlemen, that your pets can get sick from any of these as well. So let's take a start with Babesia. You have high fever. We're talking 101, 102, 103. Chills with the fever. Fatigue, headaches, muscle and joint aches. Very strong loss of all appetite. You just don't want to eat. And cough. How do you diagnose it? It's very simple. As a doctor, I take a drop of blood, put it on a slide, put the slide under a microscope, and look at the red blood cells because you can see the Babesia parasite inside the red blood cells. Takes a minute. And that gives you the direct diagnosis. What about Bartonella? Bartonella is also known as cat scratch disease, usually from a cat. Now, usually, and stray cats rather than, your pet. Low-grade fever, not high, just a slight fever. And this is a big one. Enlarged, tender lymph nodes 1 to 3 weeks after the scratch from a cat. So really large and very painful lymph nodes. And at the site of the scratch, what we call papules or pustules will form. These look like ripe acne or zits. The problem is that blood tests do not reliably differentiate among Bartonella species, and positive tests results can persist years after treatment. So although you were treated, you go see some doctor, he looks at the test results, not under the microscope, and says, oh, you have Bartonella. Well, really, you had it years ago, but it still will show up in your blood. So, although Lyme disease originates from a tick bite, symptoms are from the inflammatory process, okay? 2 people bitten by the same tick within minutes or hours of each other, that tick carrying the bacteria that causes Lyme disease, Borrelia, and 2 people will respond completely differently. Same tick, carrying that same Borrelia bacteria, two different, completely responses and manifestations. Now, here's a study published a couple of years ago. Just says that Lyme disease is caused by several species of Borrelia. And we now estimate that nearly 500,000 new cases are diagnosed and treated for Lyme disease annually in the United States. So it's an infectious disease that is manifested primarily by the skin, then the nervous system, and then the joints with joint aches and pains. The first sign is usually a bullseye lesion in 70% of the patients, which might be accompanied with non-specific symptoms, such as a headache, some fever, not feeling well, fatigue, muscle aches, and joint aches and pains. Now, here's a patient, and here's what it looked like. As you can see very clearly, it's a bullseye. If untreated, the disease might disseminate to other organ systems, including the heart, joints, and the brain. Lyme neuroborreliosis, in other words, Borrelia infection in the brain, is the most common manifestation after skin. If it's not on skin, then it goes to brain. The infection in the brain is seen only in 2 to 4% of all cases of Lyme. So what that means is 96 to 98% will not have any Lyme in the brain. What is the manifestation in children if it affects the brain? Facial nerve palsy in 55% and meningitis. That's how you can tell in children. Now, accurate testing is of utmost importance because too many practitioners are using the wrong test because they're not aware that the method of use that the lab uses for the test is not acceptable. Listen to this. I showed you that 500,000 cases per year, but there's 5 million tests done every year. Patients can have a positive test from cross-reacting with another infection or an inflammatory disease or previously treated Lyme. Many clinicians look for co-infections with Babesia and Bartonella, and in this study they said, but they failed to look for mycotoxins. So, you're treated for Lyme for some time, and then they do the test again. Oh, it's still positive. Well, yes, it will be positive for years. Doesn't mean you have Lyme. A positive blood test alone does not establish the presence of Lyme infection. Blood testing should be ordered only if there is an adequate clinical suspicion of active borreliosis, in other words, active Lyme disease. And both IgG and IgM antibodies to Lyme can persist for several years despite a clinically healed infection. The other part of this is Lyme antibodies or Borrelia antibodies can be found in 5 to 20% of normal people. Well, here's a study from Johns Hopkins University. It's called Mistaken Identity, and it's very, very interesting. Many diagnoses are frequently misattributed to Lyme disease. Out of 1,261 referred patients for Lyme, 84% had no active findings of Lyme disease. The patients were referred for Lyme, but they had chronic symptoms, but it was not Lyme. 84%. Only 16% had Lyme. So when you're diagnosed with Lyme, or you, as a clinician, you diagnose someone with Lyme, keep this in mind. Lyme disease infection typically causes dermatologic, meaning skin, musculoskeletal, neurological, and cardiac illness. These are what they can do. So, multiple complications and adverse outcomes due to unnecessary antibiotics, antibiotics prescribed longer than recommended, or unconventional treatments for Lyme disease have been reported. This is a 14-year retrospective study, meaning looking back at everything. It showed that 65% of patients referred for Lyme disease, but without objective evidence, had other diagnoses that could explain their frequently long-term symptoms. Another study of 788 patients revealed that 23% had Lyme disease. The remaining 77% had something else. Unsuitable tests. Well, look at, for example, PCR. It's not an acceptable test. That is one major laboratory that touts they do that. Look at number 4, enzyme-linked immunospot, the ELISpot, also known as the immunospot. That's the other laboratory. I'm not going to mention names, but you know who they are. This CD57 and all that. No. The visual contrast sensitivity test, known as a VCS or gray shade tests. No. So, folks, all those tests are no good. If they test you positive, this study, and you can see it, it's right here, so you can look it up, published. Here's another one, our prevalent diagnostic techniques, the benefits and drawbacks. In a recent study, urine-based PCR for Lyme disease was evaluated and shown to be insufficient for a diagnosis. Published study again. What is the most sensitive and accurate method for detection of Lyme disease and other tick-borne diseases such as Babesia, Ehrlichia, Bartonella? It's the multipeptide test by Immunosciences Laboratory. They are the number one, and it's the only test anywhere that's patented. That's how good it is. Here's a comparison between Western blot and the multipeptide test. So you see the first line. Does it detect antibodies against Borrelia or Lyme? Both of them do. But is antigen used to represent these bacteria found in human serum? Western blot, no. The multipeptide, yes. Look at all the no's. Now, number 10, is the method subjective or objective? Is it subjective? Western blot, yes. Multipeptide, no. So, is the method quantitative? How much? Western blot, no. It's just yes or no. Multipeptide tells you how much. Can the results be used for follow-up treatment? Western blot, no. Multipeptide, yes. So you see how this test by Immunosciences becomes very valuable in diagnosing Lyme disease correctly. Now, treatment. What's the most effective way to heal patients? Early Lyme. Duration of treatment, 7 to 14 days of antibiotic. The chronic atypical symptoms post-treatment Lyme disease syndrome. The therapeutic benefit of antibiotics for patients with persistent non-specific symptoms after a correct or an incorrect diagnosis of chronic Lyme. In other words, patients with this post-treatment Lyme disease syndrome, chronic Lyme disease, was studied. They looked at this very carefully in this study, published study. The risk-benefit analysis yields no scientifically supported reason to change the current recommendation of 2 to 3 weeks of antibiotic treatment for the person who has Lyme neuroborreliosis, in other words, infected the brain. 2 to 3 weeks of antibiotics and you're done. Not months or years of antibiotics, which destroys the microbiome. Now, How do they do this? How do they find this out? Finding from studies that are substantiated by 5 clinical trials in the United States and in Europe have failed to show any improvement of this chronic Lyme with additional antibiotic therapy. Imagine that. 5 clinical trials with actual patients failed to do anything. No lasting improvement was found in any trial. No benefit was found with respect to either 2 endpoints, fatigue and quality of life. So what that means is all these antibiotics that some people are taking, no. Antibiotic side effects arose in all 5 trials in 25 to 43% of the subjects. These included diarrhea, allergic reactions, cholecystitis, inflammation of the gallbladder, thromboembolism, clots, gastrointestinal bleeding, and in 3 cases, antibiotic complications were life-threatening. So you see, a lot of people get this wrong. Most patients who have Lyme disease respond well to antibiotic drug therapy and their disease resolve. I wrote this article and it was published in a medical journal back in 2019, 6 years ago. Lyme disease and mycotoxicosis, how to differentiate between the two. And I go over many of these points. Again, the right diagnosis with the right treatment, the patient is well. The wrong diagnosis and or the wrong treatment, the patient gets years of treatment and it does not help. Mycotoxins are toxic to human beings, even at very low concentrations. And here's a study published in the journal Toxins that looked at urine testing for mycotoxins and blood serum testing. The ELISA method to detect mycotoxin in human serum comes with significant accuracy, precision, and specificity. That's what you want. Accurate, precise, and specific for mycotoxins. And that's what you get with MyMycoLab. This is the ELISA method. That's what MyMycoLab uses. So here it is. You get 14 different mycotoxins for 14 IgG reactions, which is a toxic reaction, and IgE, which is mast cell activation. For a test, complete test of 28 results, you get included is a complimentary Zoom call with me to go over the results. It's available all over the world. And believe me, people from all over the world are using this test. We get tests in from New Zealand, Australia, Cambodia, India, Egypt, Dubai, all Europe, all kind of Central and South America, everywhere. Have you ever wondered why the CDC doesn't recognize urine mycotoxin tests as valid evidence? Well, let's look at that. And the FDA also. It's not FDA approved. These labs are not validated through the FDA's standard process for diagnostic tests. Number 2, exposure does not mean disease. The CDC points out that almost everybody is exposed to very low levels of mycotoxins through food, corn, wheat, peanuts. So positive result doesn't necessarily mean you're sick from it. It's parts per billion, but we get exposed to, look at a bottle of shampoo, how many chemicals it has in it. The body gets rid of those. How many times do you walk in a kitchen that's recently been cleaned with all kinds of, cleansing agents, etc., and you can smell them, including chlorine and all that? Well, excuse me, we get rid of that. That urine is an excretion. It's where we get rid of things from the body. That's why you can detect stuff in it, because the body said out, get out, and don't come back. The other part, lack of standardization. Different labs use different cutoffs, different methods, and interpretations. This means 2 tests on the same person could give 2 different results. And their official warning, These tests can lead to misdiagnosis, unnecessary treatments, and anxiety. And they are right. Here's an AI Google test. Urine tests for mycotoxins measure levels of mold metabolites. They don't measure the actual mycotoxin. They measure the metabolite to mycotoxin. For example, you had some asparagus included in your lunch today. This afternoon, your urine is going to smell of asparagus. It's getting rid of the metabolite. It is important to note that the CDC and FDA do not endorse these tests for clinical diagnosis. Can't use them for clinical diagnosis. Blood serum antibody testing is considered more accurate for detecting mycotoxin exposure, as published studies have shown urine testing to be invalid. Well, here's what the CDC says: use of unvalidated urine mycotoxin tests. Here's a study that just came out earlier this year. It involves the urinary excretion of T2 toxin. Its findings indicate that approximately 20% of the time can be traced back to the urine, meaning the other 80% can't. Only 20%. Here's what the National Institutes of Health put out on their website earlier this year: Mold and Your Health. And it's the National Institute of Environmental Health Sciences under the National Institutes of Health. It tells you about it and what they can do. And yes, asthma, allergic reactions, cognitive issues, mental health issues, immune effects, cancer, all this. Differing impacts. It tells you make a difference. Mildew is not mold. So, and they relied on 16 tests. Look at number 8. That's a chapter I authored in a textbook on this. Now, here's the oat test. Several popular organic acid tests claim to detect imbalances in gut bacteria and fungi, but most of the microbial markers of these tests do not measure what they claim to. This is from this study. So, look for the body burden. Well, how much is in your body? Not how much is coming out of your urine, being excreted, thrown away. Here's a research article that was published 5 years ago showing that the GI map is only 26% specific, meaning 76% of the time is not good. Ultra-processed foods keeps us from healing or feeling well or doing well and makes us more propense to have other diseases. Breads and breakfast cereals, cake, ice cream, and other sweets, soft drinks, fruit drinks, frozen and packaged meals, pizza, salty snacks, milk-based drinks, packaged baked goods, chicken and fish nuggets, instant noodle and soups, packaged cheeses, bottled dressings and sauces. This was done at Dr. Vrzdani's lab in Los Angeles. This is a pH measure. This measures how acid or alkaline something is. The number is from 1 to 14. 7 is neutral. It's water. 7 is water. Higher than that, the higher it goes, the more alkaline. And the lower it gets, the more acid. For example, vinegar, plain vinegar. You know, it looks like, it has colorless. It looks like water. Plain vinegar. pH is 3.7. This is Coca-Cola. pH is 2.18. What does that mean? You have to fill it with sugar. Supplements. Let's take a look at this too. A recent study found that 11% of 60 tested supplements, 11%, actually contained an accurate amount of the key ingredients listed on the label. What they did is they took these 60 most popular supplements, took them to the lab, and at the lab, They measured how much is actually in the bottle, in each capsule or tablet or whatever, and what does it say on the label? Do they match? 11% matched. 40% had nothing, did not contain a detectable amount of the ingredients at all. How important is that for sick people to be taking the right or the wrong supplement? Heavy metals, an analysis of 40 dietary supplements for the presence of lead, arsenic, mercury, cadmium, pesticides, found trace amounts of one or more in 93%. I don't want that for my patients. And in one study, it reported that botanical supplements, botanicals are usually made from plants, plant species, oregano is a popular one, and others. These contained plants. They were not listed on the label. Active ingredient substitution was in 83% of the companies tested. What does that mean? How do you get the right supplement and the right vitamin? Here's what I found. DetoxPure.com. All of these, 100% purity. They were checked by a third-party lab. Not only for pesticides and heavy metals, but also for insect parts. Negative. 100% pure. So if you want to take the right supplement, Detox Pure. This is from a patient. Thank you for all you do, Dr. Campbell. You're helping our entire family who's been ill for decades. Soon I'll write a novella and share the story with you. And now we're also sending friends to you as well. You and your generous sharing of your experiences and wisdom are so deeply appreciated, no words can express our gratitude. It was very kind of them. This is a take-home message for all of you. If you have a patient that's been diagnosed with chronic fatigue syndrome, fibromyalgia, chronic Lyme disease, who's seen a number of doctors without relief and continues to be sick, do both the Immunosciences Lyme test and the MyMycoLab mycotoxin test. You will find the correct diagnosis that way. That's the best way. That's what I do with all my patients. And if you look at the color of my hair, I've been practicing for quite a while. For questions, copies of my publications, etc., email me at immunedoctor@gmail.com. So folks, I've given you the key elements for differentiating all these commonly misdiagnosed patients. We talked about chronic Lyme, we talked about mycotoxins, chronic fatigue syndrome, fibromyalgia, all these things. You have the medical and scientific evidence from studies. This is not from Dr. Facebook or Dr. Google or what somebody says on their website. This is accurate medical and scientific evidence. Any questions, immunedoctor@gmail.com. We'll have another one of these webinar videos soon coming up for you again, giving you the medical and scientific information you need to get well and heal, not get treated for years. Thank you for listening. I appreciate it. I'm now going off and I'm going to have some tea. Thank you. Bye-bye.